Jan and Deborah spoke a bit, emphasised competition, and I suppose our question is around that a bit. One is, what do you see us needing to do in order to work with you to deliver essential public services in the long term? And then secondly, do you think there is an opportunity for us reframing that a bit with you to find new ways of working with you rather than in competition in order to deliver public services in the long term?
I think competition obviously raises challenges, but I think it also raises opportunities for a lot of the NHS in the past. There hasn't been an appetite for competition, which means there hasn't really been a willingness to open up services that could be opened up to the community of a voluntary sector. And I think that in many parts of the country that has changed too slowly. And in Bristol, I think we've demonstrated, hopefully, that we are interested in using competition to create diversity in provision, and that we recognise the advantages of that. And I think what we have to do is to keep in this difficult period, and this very uncertain and changing period, we have to keep working together to build those partnerships that will allow us to still do the competitive things we're required to do, but work with you to spot the opportunities. There are opportunities in personalisation, there are opportunities in the sorts of things that I've talked about how, as we recommission mental health services, we think about the preventive agenda, we think about neighbourhoods and creating healthy, sustainable neighbourhoods. And I think our engagement process is a good example, because it's given us, you collectively, and the 6-month engagement process has given us a lot of feedback about how best to go about that commissioning to get diversity, to get more sustainability. And that kind of illustrates big society, doesn't it? So I think we need to keep building on those things and spotting the positives and spotting the ways in which there's been, I think, a lot of concern expressed about what happens to the most vulnerable people in society. And again, there are opportunities in this for us to work together to strengthen all of that.
I think that's right, and I think it does allow for services to be more tailored to very local needs, which I think is incredibly important. I think going to your point about are there more opportunities for us to work together? Yes, and absolutely there should be. I'm not going to tell you which organisation, but I was talking to a particular social worker this morning who actually expressed to me a concern about a local voluntary organisation that wasn't going to probably exist in the future, and the impact that that might have on their work at the local level. And we really do have to take, to be cognisant of the impact and actually say, what is it you're doing, what is it we're doing, and how can we work in partnership to make sure that actually, that works well, and we don't necessarily make a service vulnerable where we're actually very reliant on it. And I think making sure we acknowledge and value those services and look at if we can work together differently. And I think we are absolutely going to have to do more of that.
You want to add anything? Was the question?
So, well, I think, again, it's difficult always coming last because they've answered.
You can go first next time.
Okay. I think everything that's been said, recognising competition, yes, the government is looking for a range of providers. The legislation opens up opportunity, and the voluntary community and social enterprise sector are very much in there, but along with other SMEs and opening up to the private sectors too. And I think, as the voluntary sector, you do have opportunities to be able to compete against those other sectors. You just have to consider how you make your offer. You know your services, you know what you can provide, and it's being doing that reality check. What is the added value that you can add that other organisations can't? I think we touched on it earlier that there's the local perspective that a local voluntary community sector can add in, and I think it's people that are commissioning understanding that and potentially adding elements into their criteria that local knowledge is kind of core and important to the process. And there is freedom and flexibility to do that still within EU regulations. So I think it is that partnership working and being close to commissioners to understand their needs, but for you to kind of tell them what their needs are to some extent. And it's that partnership working that in itself hopefully will lead to more opportunities for the sector to be able to deliver them.